Hi, please have a seat.
Hello, doctor.
Yeah, I'm Dr. Rishabh, and I suppose you are Joseph Short.
Yes,
Right.
doctor.
Okay, so what brings you to the hospital today, Joseph Short?
I'm feeling chest pain right over here.
So you are feeling a lot of pain.
Yes, doctor.
Okay, that's fine. Since how long have you been feeling this pain?
Doctor, it's like from for past 40 minutes. It's very severe, but I am feeling pain since the morning. I woke up at around 5 o'clock in the morning, and since then I am feeling the pain.
Okay, and on a scale of 1 to 10, 10 being the most severe pain you've ever experienced, how would you score your pain right now?
Uh, Around 7, doctor.
Around 7. That's a lot. So is this the first day you had just this pain, or you've been having this previous recurrence too?
Yes, doctor. I am feeling these kind of pains from the last 3 months, doctor. I have severe episodes in every week for around 2-3 times, and these episodes go for around 5 to 10 minutes, I guess.
5 to 10 minutes?
Yes, doctor.
Okay. And tell me about what kind of pain you are in. Like, is it a burning sensation or pressure or?
Pressure, doctor. Pressure it is. I think something is sitting upon my chest.
Okay.
Yes, doctor.
I understand you're in a lot of pain right now.
Yes, doctor.
Okay. No other symptoms like abdominal pain or nauseated or
No, doctor.
nothing
Nothing like that.
And do you feel nausea too?
I do feel nauseated, but I did not vomit, doctor.
Okay. But you don't have other symptoms except nausea.
No, I don't have.
Okay. And what about the previous episodes? Like you said, you've been having these episodes for like past 3 months.
Yes, doctor.
What about them? Did that intensity alleviated, or you have the constant pain, or the pain you're having right now is way more severe?
It is constant, but today the episode went very long, doctor.
And I would like to know about your past medical history, if you could tell me about it.
Yes, doctor. Recently, I was diagnosed with hypertension around 5 years ago, and then I was also diagnosed with high cholesterol. Doctor advised me to take a good diet, but to be very honest, I was not very much compliant with that diet plan. And around 10 years ago, doctor, I was also diagnosed with GERD.
Okay,
Yes,
the gastroesophageal reflux disorder.
Yes, doctor. That's right. That's what it is.
And are you taking any medicines for that?
Yes, doctor. I am on Malox and diuretic, I think.
I understand.
Yes, doctor.
And any other things you want about? That's it, right?
That's it, doctor.
And okay, I know you've been feeling a lot of pain since the morning, but it's my job to be sure what you're feeling and treat the right way.
Thank you.
And I want to know, just to be sure I don't miss anything, about your family medical history.
Okay. Actually, doctor, my father died at the age of 72 due to lung cancer. And
I'm really sorry for that. I'm sorry.
And my mother is alive, and she just have a minor peptic ulcer.
Okay. Well, I suggest you take good of her.
Yeah, I do. I
Okay.
try my best.
Yes, that's good. And since coming back to you, because you're my patient right now, right?
Yes.
I wanted to know about, is there anything else you want to tell me about your family medical history? Like, are there any heart patients in your family or anything else?
No, doctor, I don't think there was any casualty with the heart attack.
Okay. Because I understand most of the symptoms you have surely give me an insight towards your heart issues, but just to be on the safe side, right?
Yes, doctor.
Just bear with me. I have a few more questions.
Very well.
Okay. What about your occupation? What kind of work you do?
I am an accountant by profession.
Okay, that's good for you.
Thank you.
And I suppose that doesn't include a lot of physical work
No, I
towards your heart.
just sit on my bench and work on my computer all day.
Perfect. This might be a bit offensive to you, but I want to ask about the alcohol or drug use you do. Do you consume alcohol, and how often do you do? If yes,
Doctor, to be honest, I do take alcohol once in a while.
good for you. That's good. And what about cocaine? Is any illicit drugs you do?
Yes, doctor, I do cocaine, and like I do cocaine once every week actually.
And when was the last time you had cocaine?
Doctor, it was yesterday afternoon.
Yeah, I see. Look, there's nothing to be ashamed about. I'm your doctor, and we have a privilege, right? Nothing goes beyond this four walls.
I understand.
Okay, and since how long have you been using cocaine?
It's around 25. For cocaine, it's like around 10 years only.
Okay. I beg your pardon, you're going for 25 years. Is there something else you do, like smoking or anything else?
Yes, doctor, I was doing smoking from the last 25 years.
25 years, and how much? Like,
Only a packet a day, a box a day only. That's it.
that's not only, brother.
With that much pressure I have, it is.
Well, Mr. Short, being a medical professional, my honest opinion to you that most of the symptoms you have shows towards some cardiac issues mostly, but there could be other things too. And I want to do an ECG with you, and it's mostly likely to eliminate other symptoms, like you could be having an acid reflux, or maybe a lung disorder, or it could be blood vessels in your chest wall disrupting. So we want to be very, very precautious and being diagnostic tools. I want you to do an EKG right away.
EKG.
Yeah, in EKG,
Okay,
electrocardiogram.
I don't have any idea about that, doctor.
That's all right. It's okay. It's just a simple procedure where we monitor your electric impulses of the heart, and by that impulses we can find out the cardiac activity you have, the how your heart is functioning right now. It's just a simple test, and it can indicate us towards what kind of cardiomyopathy you have.
Okay, doctor.
Okay, it's just a simple test, nothing to worry about. And one more thing I wanted to ask about, that the cocaine thing you have, right? I
Yes,
want you to stop it right away.
I will
right.
try my best. I
First
understand.
reason is that it does induce in cardiac illnesses, because in your case you have you might be having any cardiac issues too. And second reason is it's very frequent that you've been using cocaine. That's not very good for health. Right? That's my opinion for you, and my consultation to you too. That stop cocaine right away, because it affects your heart condition right now. And it's good that you've stopped smoking tobacco, right?
Yes, sir.
And that's it. We'll see from where things go from an EKG, and just keep taking your medications right now. Like you have been Malox and diuretics, right?
Yes, doctor.
And for the pain right now, you have still in pain, right? I suppose you're still in
Yeah,
pain.
yeah,
So I'm
doctor.
writing you in sorbitol, right? What it does is basically acts an sublingual pathway to the drug. You keep it under your tongue, and it dissolves. And through that passage, it goes towards your heart and dilates it. The blood vessels there.
Okay,
So basically, you'll get some relief if there is an disease with your heart.
okay, doctor.
So that way, we could also come to the point that it could be an heart issue. Be certain about it, and then we'll see where things goes.
Okay, doctor.
Anything else you want me to answer?
Doctor, I'm worried about my job actually. Can I do my job
Well,
continuously?
Honestly, Mr. Short, you have an accountant job, index job, I guess.
Yes, doctor.
Okay,
Yes.
and I don't think that could be a very big issue, but unless and until you lose stairways and avoid stairways, right? And too much pressure on your heart, and everything will be fine. Just keep visiting, and we'll see where things go. But right away, just get an EKG, and we'll see things.
I will
Right.
try my best. Okay.
Just clear things out,
Okay, doctor.
and take yourself.
Thank you, doctor.
Take care of yourself.
You're very kind, doctor. Thank you.
This is all right. Thank you. Take care.
Thank you, doctor.